and welcome to my YouTube channel. My name is Wangoi Mwangi. This is Nursing with Koi, and this channel is all about matters nursing. I do health education regarding specific diseases, and I have a bias with oncology nursing because I'm an oncology nurse at the moment. So number one on the list is comfortable shoes, and in Kenya there is a prescription of the nurse's uniform, and shoes are part of that uniform. A nurse should either have black shoes, brown shoes, and white shoes as per the Nursing Council of Kenya. However, I don't see most people in white shoes. I either see brown or black, and mostly black. The shoes again must have an easy to clean material, so you're not allowed to wear something like canvas, something that is porous that can allow fluids to seep through. You should have something that will protect your feet in the event that something pours on you. So they should be either leather shoes. They usually have a bias for leather shoes. However, for as long as it is smooth on the surface is not porous, and the material is not absorbing the dirt but can actually be wiped off clean very fast, that is an ideal nursing shoe. Another thing is about the heel. It should be flat, and if you have struggles with flat feet, or you have issues with your feet physically, nursing will require you to be on your feet a good amount of hours in your shifts, and therefore you need to be as comfortable as you can. Up to now, I haven't figured out this part. I'm still trying. I've been experimenting on different types of shoes, but I have realized Skechers or sports shoes are better than any other types of shoes. However, I have even done tafis like the ones students wear in school, but then they were too heavy, and then I switched to the Skechers. If you're getting the Skechers, again, remember the material has to be smooth and not porous, and not absorbent to the dirt particles coming into the workplace. So therefore it should be something like leather or something that is continuous there. Nowadays, I'm seeing in some practices here in Kenya, we are using a lot of Crocs. Again, that's a new thing. It never used to be there. In the past, everybody insisted you have to be in black leather shoes, or black shoes, or black, brown, or white shoes that are closed all round. But nowadays, I'm seeing most people preferring shoes that are open at the back, and sometimes the Crocs will even have holes, but that never used to be allowed in the past. So that's a thing I have seen now. But my day in nursing school, you had to have black shoes, black leather shoes, brown leather shoes that are continuously not open anywhere, and they do not have anywhere with holes that water could go through or any liquid could seep through. So number two on the list is a watch. A watch is very important. A watch that has second hand, as in it can tell time and you can be able to count your seconds perfectly. This is because it will enable you do those procedures that require you to count things, and especially if you're doing vital signs, if you're counting the pulse rate, the breathing rate, the respiratory rate, all those rates, you have to count them in seconds. Like how many in a minute? A minute has 60 seconds. So if someone has a pulse that is the rhythm is regular, it is audible, it is palpable, that pulse you can do for 15 seconds, and then you multiply by 4. So for example, if you find in 15 seconds the pulse rate was, let's say, 20 beats, then you multiply that by 4 to give you 80, instead of doing for the whole minute. But for patients with weak, thready pulses, then you have to take for a whole minute, and that is why you need a watch that has a second hand, because that second hand is what is going to help you calculate. If probably you're monitoring a mother in labor, we usually monitor the contractions every 10 minutes so that you're able to tell the intensity and the duration that each contraction is lasting. And how best to do this if you do not have a second-hand watch? Again, you need to have one, because you need to tell every 10 minutes how are these contractions like, how long are they lasting, because remember, a contraction will not last like minutes, it's usually in seconds. But then as you draw close to the second stage, it can last even 45 seconds to even close to a minute, and this is when you know that now we are in established labor and probably we are progressing into second stage. So you need this watch. We usually have nurse's watch. However, it is allowable to have any other watch that it has the the second hand. But the advantages of having the nurse's watch is because you're able, if you're doing procedures, most of the procedures probably you'll be doing while other things, so your hands are already occupied with the patient or with the procedure instruments. So if you have the nurse's watch on you, all you need to do is look down and you're able to see. And when you have it on your, let's say on your collar, or I mean on your pocket, on your top front pocket, you're able to look down and actually see and tell the time and be able to count whatever it is you're calculating. Another thing, when you're doing or starting your drips, especially in infusion therapy, which is in chemotherapy, that is exactly what you're usually doing. Whilst you're titrating your drips or infusions, you will need something to calculate that against. So we usually say we are doing this number of drops per minute. So how will you know per minute if you do not know per second? So that is what is going to help you. Some infusions will just come and you're told to do this infusion in 8 hours. So you're going to really have to calculate the amount of drops that you will require to be titrating every minute, so that you're able to tell how many mils are you calculating per hour, so that you are able to generally know your infusion rate will end at what time. So if you're projecting 8 hours, you will know up to how many drops per minute you're going to put. So again, you will need a watch. So basically, if you have the nurse's watch, that is ideal. However, even if you have any other second-hand watch, the only other disadvantage is if it's a wristwatch, if your hands are engaged with things, especially during the patients, you have to be multitasking. So if you wanted to check time, you will have to pause and actually count. But if it was on you, the watch was on you, like the nurse's watch is, you just look down and continue with as many tasks as you can at a go. So another thing you need is a comfortable backpack, and this is essential for me because you will, especially if you're in a large school, in a university. I was in a university and we had to walk from different blocks that were kilometers apart, and that is during the same day, and you have to rush through your classes. And since I was in class from 7 sometimes to around 5, with a lunch break of 1 hour, it means I will have to have a place to put my things for that day. And since you have the writing material, or if you type your notes, that is well and good, because all you need to carry is your laptop. But at some times, if you have to do handwritten notes, then you remember you have to carry your books, your stationery, your textbooks, all those things. So basically, a comfortable backpack that will not hurt your shoulders, because at some point my shoulder joints were actually really hurting because of the amount of the weight that I was carrying on my back, until I had to get a very comfortable backpack. And most of these laptop bags are usually more comfortable on my shoulders than any other bag, especially with a little bit of weight involved. So my school also required us to have a nurse's dictionary, and this is a dictionary that has terminologies that nurses will encounter in their profession, and it actually explains to you what everything is and some of the procedures and some of the medical terminologies that you will find. This dictionary came in handy. I don't know where mine went after school. I don't know. I don't remember. I actually cannot trace where it went. I don't know whether I gave it out. I don't know whether I lost it. I don't actually remember where mine went, but I had a physical dictionary, nurse's dictionary. And then we also required to have, so another thing now on my number 5, you had to have a Nursing Council of Kenya procedures manual, or nurses procedure manual. And this is the manual that all the procedures that nurses do and have jurisdiction of right here in Kenya. So number 6, you need to have a name tag or a name. So number 7 is a pair of scissors. It is so important to have a pair of scissors, and any pair of scissors actually works, especially the smaller sizes one that you can put in your front pocket or in your small pockets. But we have for my nursing school, you're required to have a Mayo scissors. So number 8 is about stationaries, and this is things to write with and places to write on. And you have to have pens of different colors. You should have at least a blue, black and red. Those will help you, especially when you're documenting in the workplace, and again when you're doing your notes, if you do handwritten notes, because they come in handy in differentiating your topics and your subtopic and emphasizing. Then you also need a small pocket book and or a small diary that can fit in your pockets, or in your school, in your fanny pack, or in whatever small bag that you use when you're at work or in the clinical area, because it should be there so that if you are to take, let's say for example, a report, and as handing over a report, you're able to note a few things down. So number 9, this is not an essential per se, you can go through without it. It's a laptop or an iPad, but it actually makes your life much easier, or having a computer of some sort. I never had a laptop until I think after graduating campus, but I actually had a desktop, those very large PCs. So another essential item, if you have a smartphone, again, having earphones or earplugs, those would be very, very essential, because sometimes you have to learn using audiovisual aids. Maybe you're watching a video on YouTube or about how to do something. So number 11 is a work planner or a diary, whatever works for you. Work planner, you can actually even do it on a sheet of paper. You just draw lines and you're able to plan your week, your month, your year, depending on how busy your schedule is. In school, my schooling was quite easy because it was in blocks. So we used to go for 2 semesters in the university and then a complete 4 months in the clinical area. So all I needed to know is what am I going to do this semester, and my units. If I'm in the school, I just need to focus on those units and pass them. Once you do the first semester, because the year had 3 trimesters, so 3 months, and then 4 months you do the other one. It's usually 3.5. That gives you 7 months, and then about 4 months to complete that year. So the break that you will get to go home is usually less than 2 months. So doing my work planner was actually quite easy, because if I am in school, I only need to plan about the units of that semester. Once I am done with that, I just focus on passing that exam and finishing that unit, passing and putting a stop on that one and doing other things as I wait for the next one. So another thing on my list is a stethoscope. A stethoscope is actually essential, you should have, but if you do not, or you can't afford it, nobody will actually tell you you have to get it. But especially that semester in school, where you'll be doing a unit called clinical methods, that's about assessment, head to examination. You need to have a stethoscope, because when they will be talking about auscultation, and when they will be talking about listening to heart sounds, and when they will be talking about listening to lung sounds, how are you going to listen to that without a stethoscope? So yes, number 13 is a foldable folder or clipboard. This will usually help you, especially when you're doing your history taking, so in the clinical areas as a student. And if you're a nursing practitioner or you are a nurse, you will need it again when you're doing your history taking and you're at the bedside and you don't want to carry everything to the bedside. So another thing that is a must-have is a pen light, and especially the unit where we are doing about clinical assessment. So another essential item, this is number 15, is having a dust coat. Especially if you're a gentleman, having a dust coat always comes in handy, because even if you're in uniform, when you go to the clinical areas, you must be in a dust coat. If you come from a nursing school that do not have school uniforms, then you need to have a dust coat, even if you are a female student, because up until recently, I'm seeing now students wearing scrubs. We never used to have those. We just used to have our home clothes, civilian, and then you just put a dust coat on. And that is how I navigated my nursing school, with civilian clothes and a dust coat.